I'm Lauren Schuster, and you're watching Medically Speaking on Fox Bloomington. Novant Health is expanding access to cancer care across the region and is bringing advanced treatments right here closer to home. And now I'm at Novant Health Scotts Hill Medical Plaza, and I'm joined by radiation oncologist Dr. Rex Keightley. So thank you for joining us. Tell us a little bit about yourself and your specialty.
Well, thanks for having me. My name is Rex Keightley. I'm a radiation oncologist here at Novant. I've been here about 10 years. Before that, I was on active duty in the Navy. Did this job, radiation oncology, at Bethesda Walter Reed for 13 years before, but many other jobs prior to that. But I'm here now for the last 10 years.
Amazing. And tell us about this expansion that is happening here.
Right, so probably a little over a year ago, maybe a year and a half ago, this building opened to start delivering cancer care to the northern parts of New Hanover County and serving Pender as well. And it really is a full service cancer center. We've got infusion chairs, we've got radiation oncology, a linear accelerator here. We can plan and deliver radiation treatments in the same building that patients can receive their systemic chemotherapy or other systemic therapies. So it's really trying to expand the cancer access, the footprint for cancer access across the area.
Yeah, and let's talk a little bit about that, because something to help prevent this is screenings.
Absolutely. So there's several screening tests. Of course, women should get their mammography done, pap smears, that kind of thing. Colonoscopy is important once certainly by the time you reach age 50, for some demographics, age 40, 45 even. And then lung cancer screening. If you've been a big smoker throughout your life, you can talk to your primary care doctor and see if you're a candidate for low-dose screening CT for lung cancer.
And are all of those offered here in Scotts Hill?
That's a great question. I think just about all of that would be offered here. We certainly have the ability to do CT scans and lab work, so yes.
Now I hear there's a new service that you provide here.
That's right. So in addition to cancer care, we also, there's a new indication for radiation where we use low-dose rate radiation therapy to treat osteoarthritis for patients that aren't responding well to other therapies like medication or injections, etc. There's new information out there that low-dose rate radiation may provide them some relief for their arthritis. We offer pretty much cancer care for any malignancy that a patient may be diagnosed with. So breast cancer, lung cancer, head and neck cancer, skin cancer, colon cancer, any of the major types. We pretty much can do everything here other than some of the really ultra specialty things we would perform down at our 16th Street or at the Zimmer Cancer Institute. So brachytherapy, which is where we do high dose rate procedures that deliver radiation directly to the area. And also radiosurgery, which delivers high doses of radiation to brain tumors or brain metastases.
And lastly, you've been at this for quite some time. What is something that you love about being here and doing what you do?
This location is fantastic. It's it's a brand new facility. Patients often comment about what a great staff we have, and that makes you feel good as a person that's delivering the care. But I think probably the most enjoyable thing is when patients come back for their first visit and we think they're cancer-free and show them scans that are clear. It's pretty rewarding.
Amazing. Well, thank you so much.
Thank you.
And for more information about Novant Health's Cancer Center, visit novanthealth.org. If you've been dealing with urinary symptoms, there may be treatments that you've never heard of before. And now we are joined by Dr. Wu Su with the Advanced Urology Center for Robotic Surgery. Thanks for joining us.
I'm glad to be here.
And now tell us a little bit about your specialty.
So I'm a urologist, which means that we deal with anything related to the urinary system, all the way from the kidney down to the bladder and to the urinary system. And that includes any conditions such as cancers affecting any of those organs, to prostate cancer, to any urinary issues, whether it's urinary leakage or urinary blockages for both men and women, and as well as kidney stones.
Yeah, and so, of course, like you said, these could happen to both men and women. But what we really want to dive into today is men having these symptoms.
And one of the things that I always say is that men don't tend to pay attention to their symptoms as much. And so even when it's happening and they kind of notice it, they tend to ignore it. And usually when it comes to the urination, it starts with slow urination, can't pee, takes a long time to pee, blood in the urine. All of those symptoms are things that can happen in men, and they just push it to the side or ignore it, and that's really not a good thing to do.
Yeah, because then that's when it would just keep getting worse.
That is correct. And one of the benefits of doing this, and when you see this symptom seen your urologist early on, is that a lot of these conditions are things that we can actually take care of and often cure them, and then you can go about living your life.
And now, is there a reason for men to come into your practice before this even happens? Like you're saying, is there a way that they prevent this?
In general, all of us are supposed to be seeing our primary doctors, and that's something that men don't do very well with, and that is a starting point. Men are supposed to be seeing their primary care doctors, and they're supposed to be getting their routine blood tests and everything. So if they have any urination symptoms, waking up too much at night to pee, they mention it to their primary doctor, or they have blood in their urine when they go to their primary doctor and they check their urine, or if they see their primary care doctor, they check a blood test called a PSA to check the overall health of the prostate. All of those things that can help the primary care doctor identify who needs to see a urologist and who does not.
Yeah. And now let's talk about the new innovative ways that you guys are treating certain conditions.
Yes. So enlarged prostate is one of the most common common conditions in men. All of us men, we have prostates. As we get older, unfortunately, the prostate enlarges. The prostate is located in an area when we urinate, it goes through the middle of the prostate. So imagine that when the prostate is getting bigger, it is basically putting a squeeze on the tube that men are peeing through. When that enlargement happens, it could long-term have significant effects on the bladder and the way the bladder works. And so there are conditions that we call enlarged prostate or BPH that men see a urologist for, and we have many different ways of taking care of this condition.
Yeah, and something, that everyone is doing nowadays is implementing robotics.
That is correct.
And let's talk a little bit about that.
So imagine that a man comes to see us and we do the necessary tests and blood work and imaging and they find out that they have enlarged prostate. Once we identify, is this because of cancer or is it because of enlarged prostate, which is a benign condition? If it is cancer, we have robotic surgery that we do, minimally invasive surgery that men recover faster for. We are able to do that to cure prostate cancers, assuming again we find it early on. And then we have the enlargement where we have technologies such as aquablation to basically treat enlarged prostate. It's a robotic way of kind of doing surgery that used to be done in the past, but with more precision and more accuracy so that there is less side effects and then the recovery is much easier.
Yeah, I mean, just hearing about these robotics, it seems it is helping the world of these surgeries, it's more precise.
It is, and sometimes what I try to despair is that when people hear robotics, they think robots are taking over the world. This is actually not the case. This is a little bit different in the sense that we are using the benefits of robotic technology. I am the surgeon, so I am still doing the surgery, but I'm using the benefits of robotics to be able to do something minimally invasive, like small 10 little incisions, or sometimes no incision at all, when in the past would have to cut you open and put my big hands in there to be able to do that. So that's the benefit, is that we are using these technologies to help us do the same things that we used to do, but in a much more efficient way and in a much more less burden on the patients. So
amazing. And now let's talk about your practice. I know you have 2 different locations. Are you taking new patients?
Yes, we are taking new patients. We are part of the Advanced Urology. It's the Center for Robotic Surgery. And we have offices in Leland and Whiteville, and we are taking new patients in both locations. And so you are welcome to call us and come see us anytime, and we'll be happy to take care of you.
Now, what are other conditions that tend to be common in men?
As urologists, we also deal with erectile dysfunction, and that is something that often doesn't get discussed enough. But once you get to see a urologist, these are conditions that we take care of in many different forms, with either using medications or surgical intervention. So that's one of those things that men are more comfortable talking to a urologist about.
Amazing. Now, whether you have symptoms or not, it is always a great idea to talk to your primary doctor to see if you need to see a urologist like Dr. O here. Thanks for joining us.
Thank you.
If you live in Brunswick County, then the Sheriff's Office is implementing a new program to help keep the community safe. And now I'm joined by Sergeant McCray to tell us a little bit about Project Home Safe.
Yes, well. So Project Home Safe is for individuals with cognitive impairments or just need a little bit of reassurance that somebody's looking out for them. So basically you give us your information and then we can put it into our CAD system, which is computer automated dispatch. And basically if you have a key, a hidden key or door code, anything like that, our first responders will know.
And what types of people do you hope will sign up for this program?
So anybody with cognitive impairments, whether that's autism, dementia, Alzheimer's, Down syndrome, any type of information you would like us to know about you to make you safe and also make the interaction safe as well, those are the individuals we're looking for.
And now you helped create this program. Why did you see that there was a need for it?
So basically we want everybody to be safe, right? So if we're ever doing a welfare check on you or we're coming to your house for a certain reason, we want to make sure that interaction between you and us is as safe as possible. The last thing we want is to not know something about somebody and then a tragic accident happens because of that. So anything you can give us, we would love it.
And how are people supposed to contact you to give you information?
So on the Sheriff's Office website, you can also call 910-253-2777 and ask to speak with somebody with the impact unit. And then Ian Evans, Erica Evans, myself, or Lieutenant Rebecca Allen will contact you and get the information.
So besides Project Home Safe, what are other resources that you can use to help these people?
Right, so for like missing persons, right? So with Alzheimer's, dementia, autism, if somebody does run outside their house or run outside of a location and we can't find them immediately, we do have bloodhounds that are able to use scent articles in order to locate that individual.
And now we're actually going to put those bloodhounds to test and talk to Deputy Moore a little bit more about that program. Now I'm joined by Deputy Moore to talk more about these bloodhounds and how they're such a great resource for this program.
So the 2 bloodhounds we utilize for the Sheriff's Office are scent discriminant. What that means is if I take your scent, I can track you with utilizing these bloodhounds, and even if you are in a crowd, the dog will go straight to you and be rewarded.
And how long has this program been implemented, or how has it been going so far with the bloodhounds?
It's been fantastic. We have been operational for about 2 years.
And when you go and gather the scents, you said you put them in a vacuum bag. Is that to keep the scents in there for the dog?
So we utilize a vacuum system that collects the scent from clothes or bed sheets, pillowcases, anything like that, and it goes into a glass jar. The reason why we use glass jars is because they're non-porous and it holds scent a lot better than just plastic. They then are sealed and only unsealed to be given to the dog for the dog to get the scent.
We're going to put this to the test, and something that I actually just learned is that it doesn't need to be clothes or socks or anything dirty, but it could be like as simple as a watch, right?
Yes, ma'am. Anything that could hold your scent, being a car seat or anything that you have worn, to include metal.
Okay, well, let's do it. Here is my watch that I wear every single day.
Set it right there. Close enough for government work. And then we stuff this so it's not my odor that is on your gauze pad.
And so does that gets sucked into this jar,
Mm-hmm.
and then you open it up when the dog arrives.
Yes. And these are cleaned every time they're used, to include the screen with an alcohol pad, so my scent will not be contaminating the jar.
Okay, well, I think we get the dog and we put her to the test.
Absolutely. Let's see what she can do.
Okay, Pepper the Bloodhound has my scent, so let's see if she can find me. So after going through all those cars and a quarter of a mile, Pepper found me. Medicare can be confusing, and we will learn soon how timing truly matters. And we are joined by Kennette Bradley with NC Insurance Advisors, and we are talking about Medicare in general, what we need to know, and how to avoid costly mistakes. So thank you for joining us.
Thank you. I'm glad to be here.
So a really important question is, what is the age that people can sign up?
Generally, it's age 65. Unless you are disabled, you can sign up for Medicare 24 months later. And end-stage renal disease or ALS, you can sign up under 65. But generally, when somebody turns 65 or about 3 months before, they need to sign up. Now, back in the early days, everyone got Medicare Part A and Part B when they turned 65 because generally everybody started drawing Social Security. Now, if someone started drawing Social Security early, then they do get automatically signed up because that Part B has a premium and they want to deduct it from your check as soon as possible. People not drawing Social Security, when they do sign up, they get a quarterly bill for that monthly premium of Part B.
Let's get into timing, because timing is super important. And if you miss a specific date, I hear you could be penalized for life.
Yes, and some of the timing is signing up for Part B and Part D. Those are the Medicare parts that have penalties, lifetime penalties, if you don't sign up when you're initially eligible. There's some confusion when people are still working and they have group insurance. The group insurance is typically considered creditable coverage, so there will not be a Part B or D penalty if you retire later, and that gives you your special enrollment time because you're losing your group coverage.
And for people watching right now, we've been going over a lot of information here, and it could be overwhelming. So you get on Medicare at 65, or you could. When should they start thinking about this or even learning about this?
They can sign up for their Part A and their Part B 3 months ahead. Sometimes the software will let you do it more quickly. You can either do it by phone, calling Social Security. You can go to ssa.gov and sign up there. It's very simple. It just says sign up for Medicare.
Because is this 3 months before they turn 65 or
Yes.
3 months before the annual enrollment we were talking
3 months before they're turning 65 if they're new to Medicare. Medicare always starts the first of the month. Sometimes people think, well, my birthday's not till the 15th. Well, it starts the first of the month unless your birthday's on the 1st. Then it
Like me.
actually starts the first of the earlier month, so you get that full month.
Good to know.
Yeah.
And for those watching still very overwhelmed, they can just come in here and talk with you about this, correct?
Of course. They can call and schedule an appointment. We do phone appointments. We do a lot of face-to-face appointments. One of my clients came in who has a Medicare Advantage plan, 0 premium. He told me that he broke his ankle. The emergency room charge was $5,475. Then there was a room and board charge for $5,064. An MRI charge for $3,587, radiology diagnostic $890, and IV $505. It just goes on. Physical therapy $492. It just goes on and on to over $28,355. This man got an infection, so he had to go back to the hospital, and he stayed 3 or 4 days. The hospital then drove him to a rehab that they probably own. Non-emergency transport, $636.30, and they went 7 miles, so they were charged $238. So $874.30. This is what has to stop. What people don't look at is what the true cost is that goes through the pipes. The Medicare Advantage plans now have, I think, about 80% of Medicare recipients. 1, it's much more affordable. 2, because they're highly subsidized, you get extra benefits for dental or vision, hearing aid discounts. fitness programs. So there are a lot of things the Medicare Advantage plans do to try to help you stay well and keep you out of the emergency room.
So a big question is that people may think it's expensive to talk to you, but how much does it really cost?
Well, we do not charge. We are sharing our knowledge to help people make their best decision. And I've been doing this for 40 years, so I've seen all the changes. I was alive when Medicare came about, so I remember my grandmother getting Medicare. But no, they can call us, make an appointment, email us, go to the website, ncinsuranceadvisors.com, or they can stop in. We're here from 9 to 5.
Perfect. Well, I feel like bottom line is that learning about Medicare now could save you later.
Oh, yes,
So thank you so
definitely.
much for your
You're
time.
welcome. Thank you.
I'm joined by Dr. DiGiuseppe. Thank you so much for joining us on Medically Speaking.
Thanks for having me.
Now, let's talk about the level of care that is offered at this facility and in this region.
Novant has invested in pediatric subspecialty care. The goal has been to bring more pediatric subspecialty services here to Wilmington and really the whole region, southeast region of North Carolina. With bringing more pediatric subspecialists, we're able to increase the amount of care we can provide here, which the most important thing about that is to keep families here locally. So they don't have to travel to get the same quality care that they can get in Triangle at Chapel Hill or Duke. They can get that same quality of care here. Keeps families local and eases the burden for our families.
Yeah, and we're actually standing in a very special room because it's private, which a lot of, hospitals don't have private NICUs. So let's talk about that.
Yeah, so I'm a neonatologist. I'm a baby doctor. I take care of sick and premature babies. And this is our neonatal intensive care unit. And we're very fortunate here that we actually have private rooms. So we have 45 private rooms. So when a baby is admitted to our neonatal intensive care unit, which can be one of the most stressful things that a family can go through, they're admitted to the same room that they're going to be discharged from, and the parents can actually be with their child with some privacy. And it's really nice, and it's a big patient satisfier. Traditionally, NICUs are big open bays with multiple babies in them, and they can be a little chaotic and a little scary. So it really provides a little bit of peace for our families here.
Yeah, and when babies are in, this NICU, it's an emotional time for the families. And just walking down this hallway, there was, just great, name tags for each of the babies. And you say that the parents can decorate rooms. So you guys really try to, make it feel like home in here.
We try to make the best of a stressful situation, and really that's led by our nursing staff here. They're fantastic. Not only do they provide great care to our babies here, but they really try to provide that comfort to the families.
And you have been doing this your whole career, known as the baby doctor.
Yeah, came straight out of fellowship. I've been here 15 years. I've been able to see not only this unit grow, but really what we've been able to do here in New Hanover County to really advance pediatric care.
Yeah, and what has been, this is a very special job. What has been your favorite thing working in this division here?
Just really love working with our families, and families being local. They're our neighbors, they're our friends. I see families, there's not a day I don't go out where a family doesn't recognize me as somebody that took care of their child. And they just love to show off how well their baby's doing and just brag on the care that they got really from our nursing staff. They really harp on how great the nurses are. But it's, that's rewarding to really practice in the community where you live.
Yeah, and so you've been here for, close to 14, 15 years. Have you seen, more patients come in year after year? Because this, county in general is growing.
Yeah. So more people are moving here, more babies are delivering here, so there's more kids here. And, we've seen that growth here locally, and that foundation started since Novant came on board in December of 21. We've really seen that start to grow more exponentially too, and it just provides even more resources for us to take care of children.
Wow. Well, thank you so much for everything you do here, and thank you for your time.
Oh, thank you for having me.
You're welcome. And now everyone's health journey is their own, so make sure to take it one step at a time. Thanks. As we wrap up Medically Speaking, I want to remind you that your health journey is uniquely yours. I hope this information was helpful, and we'll see you next time.
NC Insurance Advisors help North Carolinians make sense of health insurance. Real people, real answers, real support every step of the way. Call today and protect your future with confidence. Helping people since 1985.
I want experts on my team. I want the most advanced treatments. I want to feel like myself again.
For nationally recognized neurological care, you want Novant.
This is the day the Lord has made, and we shall rejoice. Father, first of all, we want to thank you for waking us up this morning and giving us the faculties of our mind to come into service. Father, I thank you for the hearts of service of every man and woman that is here today. And we ask that you watch over us every second and every hour of this day. Father, we are blessed to live where we live. We are blessed to do what we do. I thank you for every deputy, oh Father God, that puts their life on the line every single day to protect our community. Lord, we're forever grateful for what we're able to do, and we'll always give you the praise, the glory, and the honor. Amen.
Loyalty, integrity, dedication, and service. I'm Brian Chisholm, Brunswick County Sheriff. These are the core values that guide us while serving and protecting the Brunswick County community, and the values that sustain us as a Brunswick County Sheriff's Office family. If these core values resonate with you, we would love for you to be a part of our Brunswick County Sheriff's Office family.
NC Insurance Advisors help North Carolinians make sense of health insurance. Real people, real answers, real support every step of the way. Call today and protect your future with confidence. Helping people since 1985.
I want experts on my team. I want the most advanced treatments. I want to feel like myself again.
For nationally recognized neurological care, you want Novant.